One of the differentiators of the Arcadia platform and how we've chosen to deploy the Arcadia platform is the fact that it's not just having the data and the KPIs, it's being able to merge that with the richness of operationally relevant context. So it's not just, where did the ED encounter happen, to whom was the patient attributed. It's being able to pivot that by region, by practice group, by specialty, by service line, by in and out of network, and to trend that over time is incredibly powerful. So we were looking at readmission rates. A novel insight for our organization was that readmission rates inside the network were substantially lower than readmission rates outside of the network, likely representing our ability to coordinate care and transitions of care for patients that were discharging from our system's hospitals. But hey, what about everybody else that gets admitted somewhere else? How are we closing that information gap? Again, now that we have a centralized data lake, we can start to attack that problem. We have 5 pillars of value-based care that provide the foundational structure for our analytics strategy, those being attribution, quality, cost and utilization, network utilization, and risk capture. There's various tools and analytics insights that drive each of those pillars that are accessible in Arcadia. We thought to ourselves, how do we envision rolling all these different tools out to a network that is fairly heterogeneous in terms of their strengths and weaknesses? One of the first things we did early on in the process was we brought a group of executive stakeholders, operational and clinical leaders, and we cast a vision. We said, here's some of our pain points. Everybody agreed. We said, here's where we think we can head. We solicited ideas and feedback at that point in time. We got people excited about the art of the possible. And that was foundational. People then had an expectation, hey, I have a general sense of what Arcadia is. I know it's coming over the next 12 months and I'm excited about it. That was the beginning of the change management. People knew what Arcadia was, they knew what it did and why we had it. It was very different than the execution, the blocking and tackling of, okay, now we have to build claims connectors, EMR connectors, we got to get the right resources engaged at the right time. So we handled those in parallel, and we kind of managed each, recognizing that the stakeholders for change management and for technical implementation and execution are oftentimes different. The reason that we chose Arcadia and we're looking for organizations like Arcadia was we were challenged, like many large healthcare organizations, with various data silos. We had claims, we had clinical, we had different electronic medical records within the clinically integrated network, and we were spending the majority of our time just crosswalking those data sources, normalizing to the same patient. And we were interested in going with a platform that homogenizes those data silos, that we could spend our valuable analyst time with higher secondary and tertiary order problems using the data to solve real-world business problems and keep patients healthier. Arcadia has been a great partner. The reality is healthcare analytics is a kind of foxhole. There's challenges, there's change, there's updated and evolving regulations that drive requirements for how you do reporting. And so you need a partner that's agile, willing to be agile, and has the capability to keep up with the pace of change.